Today I'm going to talk about something called as minimally invasive spine surgeries, and they are also known as minimal access spine surgeries. So people think that minimally invasive surgeries can be done only for simple procedures, but it can be applied to a number of procedures, from a simple disc surgery to major deformity correction. So everything can be done in a minimally invasive manner. So if you look at the things, like if it is a disc surgery where we just do something called an endoscopic spine surgery, where with the help of an endoscope is nothing but a camera which is introduced into a small tube kind of a thing, and then with the help of a 20 mm incision or the cut, we'll be able to perform this kind of a surgery. If you look at any infection, especially the commonly encountered infections like TB spine, so whenever patients suffer from tubercular spine infection, that also can be tackled in a minimally invasive manner, where we decompress the nerve and the spinal cord, and then we can put the screws. The screws can be placed in a minimally invasive manner just through a skin cut. With the help of a skin cut, we just pass the screws. It is called as percutaneous screw fixation. And say a lot of people then we come across patients with low back pain, chronic pain for years together, and we see that there are some degenerative changes in the spine, bone in the spine, and then because of that they require stabilization of the spine, as well as there is a lot of compression over the nerves which needs to be decompressed. So that also can be performed in a minimally invasive spine. We call it as minimally invasive TLIF, where in a small incision, in a small cut, we are actually releasing the pressure of the nerves and fixing the spine with screws and rods and a small implant which is called as a cage. And this can be done in a minimally invasive manner. And the advantage of these minimally invasive procedures is that there is a small cut, so whatever the tissue destruction that is happening is reduced, and patient can be mobilized early, and they can leave the hospital early, and thereby actually reducing the overall cost, reduction in the stay in the hospital as well as the cost to the patient. Even tumors, the spine tumors we commonly encounter patients with spinal tumors. They can be done in a minimally invasive manner, and patients get discharged in 2 to 3 days. And in a patient who has a deformity, be it a congenital deformity in the sense if the spine is curved abnormally, so it can be because of from the birth itself, or it can be following some disease. So that also can be performed in a minimally invasive manner. Thank you.